Like and subscribe and click the bell icon to get new video updates.
Country doctor shortages are taking a toll on people's health. Mallee candidates share their health care plans. People in Western Victoria are being diagnosed with serious illnesses later, and sometimes too late to save their lives, because of the region's medical workers shortage, the Rural Doctors Association of Australia President Megan Belot says. Government data compiled by the Western Victoria Primary Health Network shows the number of general practitioners in the electorate of Mallee is well below the Victorian and national averages. There are 76 general practitioners for every 100,000 people in the electorate compared to 91 on average across Victoria and 97 across the country. The numbers per patient are worse for dentists, 39% below the Victorian average, and much worse for psychologists, 82% lower. The consequences are huge, Dr Belot, a general practitioner and anaesthetist working in Cohuna, Echuca and Kerang, said. Not only will you have more acute presentations to your emergency departments, but you're also seeing people coming in with cancer diagnosis much later, needing much more further intervention, including further surgery, more intense chemotherapy or radiotherapy. But even suffering the severe consequence of actually dying from their disease that maybe if they got it treated 12 months earlier, they would have been curable. The shortage of GPs and specialists across the medical profession are nothing new in the region. But Dr Belot said COVID had made the problem significantly worse. The ABC asked each Mallee candidate what they would do to improve local health care and medical staff shortages if elected. Candidates are listed in the order they appear on the ballot paper. Dr Anne Webster, National Party Nationals MP. Anne Webster is the incumbent in Mallee. She said being a member of the government had enabled her to secure a series of healthcare outcomes for the electorate. Among them, she listed the retention of Medicare-funded telehealth, increased hospital funding, including $30 million for the Swan Hill Hospital, 80 new Commonwealth-supported places at regional universities, and the reimbursement of university fees for medical degrees in the region. Dr Webster said she had been working with hospitals, and with Trobe and Monash universities, to deliver a tri-state training hospital for Mildura. She also said a returned coalition government would spend $3.3 million on facilities for an undergraduate biomedical course in Mildura. Research shows if we do this, medical students are 75 to 80% more likely to stay local, she said. Dr Webster noted aged care received a boost in the federal budget with 15,000 training places for upskilling. The delivery of regional MRIs with MBS rebate has been welcomed also, she said. If the coalition is returned to government, we will also deliver $35 million in new funding to significantly expand the successful innovative models of collaborative care program across rural and regional Australia from the 1st of January 2023. The program will attract, support and retain rural health professionals to deliver care on the ground. I will fight for Mallee to be a site for this program. Sophie Baldwin, independent. Sophie Baldwin argued Mallee needed a flexible model of care to suit the country, where telehealth and nurse practitioners could help take pressure off local GPs. She is also in favour of incentives for GPs to practice in the region and investment in housing and daycare. It is hard to attract a GP to the area if you don't have suitable housing or daycare, she said. It is also a catch-22 if a town only has one doctor. The burnout factor is high and GPs soon move on. Doctors need to be better supported in the country, whether through financial HECS incentives and appropriately paid multi-skilled staff to help take the pressure off. Ms Baldwin argued for a templated approach, to be fine-tuned from community to community. To achieve those goals, Mallee needs a committed member. Claudia Haenel, independent. Claudia Haenel said she would ensure GPs weren't ripped out of the bush. We need to keep and retain medical staff, having them train here, she said. After kids finish Year 12, if they could be here and train through local TAFE or uni, and we can make use of our tertiary education facilities here in Horsham, then we can keep them. We also have to ensure Medicare is not going to get cut any further. We need to ensure we get more services in the bush rather than less. For people to have to travel down the road to Ballarat for a 10-minute appointment, which could be done in our local area, particularly when our roads aren't adequate, it is very dangerous. Ms Haenel also argued for national disability insurance scheme reform. We need to ensure that when people are given services or their NDIS is able to pay for services for recipients, that those services can be